Hi, I'm Jarvis Odgers, physical therapist and clinic director here at Rebound Physical Therapy. Rebound is a family-owned outpatient physical therapy clinic that has been proudly serving Topeka and the surrounding communities since 1994. Today, I will be discussing how PT can help you reduce and manage arthritic pain naturally. So I think a lot of people out there that are dealing with arthritis, think that there's nothing that can be done. Hey, I've got this arthritic joint. Maybe the only thing I can go do is run to the medicine cabinet and grab a bottle of Tylenol or ibuprofen. Well, I would like to suggest a alternative to that, which is trying physical therapy. So let's first start out by defining a couple of terms. So what is arthritis? Most of the time when we're talking about arthritis, we are talking about osteoarthritis, which is the breakdown of cartilage, which is what surrounds our bones. So a lot of times I'll use the analogy of a cavity. I think most people are familiar with what a cavity is in your teeth. We've got this protective enamel that surrounds and coats our teeth, and a cavity is when that enamel starts to wear away and we have a hole, a divot, a cavity. So arthritis is kind of the same thing. It's that cartilage that surrounds the joint starting to break down and wear away. Another common term that people hear is bone on bone. So that's usually in the result of an x-ray. I had an x-ray of my knee and it showed that I was bone on bone. So what does that mean? So when we do an x-ray, cartilage doesn't show up, but you can make some decisions on what the health of that joint is by looking at that x-ray. So a normal x-ray of, let's say, a knee, you'd have the two bones and hopefully they're resting with space in between them. And that would mean that we have good cartilage, that cartilage is still surrounding those joint surfaces and we have space between those bones. So in an arthritic joint, that cartilage has broken down and started to wear away. And that x-ray, instead of those bones being spaced, would be those bones resting on top of each other, hence the term bone on bone. So I think another misnomer is that arthritis is something that old people get. Yes, it's more prevalent in the older adult, but it is a natural process of aging that actually starts fairly early in life. Your average 30-year-old is probably going to have some mild degenerative changes in a joint. And certainly by the time we're in our 40s, there's going to be some mild to moderate changes in that joint. So what does arthritis feel like? What does it look like? So the common symptoms of arthritis is a stiff joint. Sometimes we have swelling and then also pain. So the typical person, let's use the knee as an example. If they have an arthritic knee, it's typically when they get up in the morning, it's stiff, it's sore, they get moving a little bit better and it starts to feel a little bit better. However, if we do too much, then we usually go back to those same symptoms of stiff and sore. They often return after prolonged inactivity. So if you go on a car ride, you're in the car for an hour and you get out and oh my gosh, that knee won't move anymore. So how do we fix that? In physical therapy, we don't address the actual arthritis. We can't magically put that cartilage back in, but a lot of times if we can improve mobility and if we can strengthen the muscles that surround that joint to help provide some cushion and some shock absorption, that greatly reduces those symptoms. Another way to treat arthritis is by creating motion. So one of the things that I hear from patients all the time, kind of jokingly, is gosh, if we could just put some WD-40 in there, my knee would feel better. Well, our body has that kind of natural WD-40. It's called synovial fluid. And so the more we can move a joint back and forth, the more we are spreading that lubrication. So we'll often kind of use the little term motion is lotion, that we're lubricating that joint. And some great ways to do that are unloaded activities such as bicycling, where we're not having impact on that joint. But another great activity is pool. We have a therapy pool here at Rebound, and the buoyancy of water helps us unload joints. So it's kind of amazing how many people that come in here and gosh, maybe they can only walk for 5 or 10 minutes, because of back pain, because of knee pain. You put them in an unloaded environment like the pool, and all of a sudden they're able to exercise for half an hour, 45 minutes without being limited by pain. And that gives them the opportunity to build those muscles up, to increase that strength that they need to hopefully be able to live a more healthy and active life. So if you're out there and if you got stiff joints, if you're suffering from pain, don't feel like there's nothing that you can do. Give us a call. Let our team of experts go to work for you and get you moving and feeling better.